Hello, you're welcome to my platform. I am Dr. Sandra Nabukalu and I am a surgeon. I help you become aware and sensitized about the different surgical conditions. Today's video is about postoperative synergistic gangrene or Melanus ulcer or Melanus gangrene. I have always found this condition so disturbing and worrying. This is because it has the potential to kill patients within a very short period of time. In fact, 40% of the patients die, and the death rate increases to 100% when presentation to the hospital is late or diagnosis and treatment are done later on after the symptoms have set in. The other reason is that this condition has the potential to mimic or to act like the commonest conditions, for example, cellulitis, that is infection of the cells without causing death of the cells, and abscess formation, that is collection of pus within a given part of the body. And so the patient can easily be misdiagnosed and get the wrong treatment. And this gives time to this condition to fester and continue taking a toll on the patient's body. And the patients can easily die because they are getting the wrong treatment for the wrong diagnosis, because this condition actually acts like the commonest conditions I've told you about, cellulitis and abscess formation. This is why I wanted to bring it to your attention such that you can always look out for the early signs so you can present to the hospital on time. We establish a diagnosis as we monitor you, and then we give you treatment, the right treatment, before this condition can cause irreversible changes in your body. Postoperative synergistic gangrene or Melanus ulcer or Melanus gangrene. Let's break that down. Postoperative simply means that period of time after surgery, after a surgical procedure has been done. Synergistic means to work together, to join forces, to cooperate. Gangrene simply means death of the tissues as a result of a reduction in the supply of blood and oxygen. So this means that postoperative synergistic gangrene is the death of tissues that occurs after surgery due to a combined effort by multiple bacteria. Different types of bacteria coming together to cause changes within the body and the tissues to cause the death of these tissues. When we talk about Melanus ulcer or Melanus gangrene, Melanie is the doctor that first talked about this condition. He first wrote about this condition. And so this condition was named after him. That's why we call it Melanus gangrene or Melanus ulcer. But some books call the condition postoperative synergistic gangrene. The bacteria that cause this condition, that is 58% of the composition of the bacteria is made by the hemolytic staphylococcus. Then 28% is made by the non-hemolytic streptococcus. And the 14% is made by other bacteria, for example, Pseudomonas, bacteroids, diphtheroids. These are just names of bacteria that take part in this condition. So what happens is that when someone undergoes a surgical procedure, for example, they have had abdominal surgeries, pelvic surgeries, or the patient got a minor injury, for example, they got stung by a bee, or they were hit by a bull or a cow, or they even just got major injuries, for example, from a road traffic accident, the patient is going to have an inoculation or an introduction of bacteria within the tissues of the body. By the way, our body is made out of layers of tissues. For example, we have the skin, the fat layer, the fascia, which is like a sheath that covers the muscles. Then you have the muscles and then you have the bones. So when you have any trauma, maybe from surgery or from physical trauma, like I've told you, you can easily have an introduction of bacteria. And this bacteria can easily go to the bloodstream. This results into some changes happening within the arteries and the arterioles, the blood vessels that supply blood from the heart to these affected areas. And these changes include damage to the inner lining of the arterioles especially, and we can also have encouragement of formation of clots, and the clots can easily block off the lumen of the arterioles, the small blood vessels that bring blood from the heart. And this results into a reduction in the amount of blood that is taken to those affected areas. And so the cells in those areas tend to die off, get eroded, and then form an ulcer. The other thing that can happen is that the bacteria tends to produce some enzymes, for example, hemolytic enzymes. These are going to work in a way that breaks down the red blood cells, the cells that are supposed to supply oxygen to your tissues, the already affected tissues, and also the other tissues of the body. The other thing that can happen is that when the bacteria enters your bloodstream, we can have an interaction between the cells of the immune system and the bacteria. And this results into a production of some chemicals from the cells of the immune system. And these chemicals work to widen the diameter or the size. They widen the blood vessels, especially the arteries. And this causes a reduction in the amount of blood that goes to the vital organs, for example, the kidneys, the brain, the heart, and also other organs, for example, the liver and the lungs. And so these organs tend to die off, and then they'll shut down, and the patient will get what we call multiple organ dysfunction, where all or some of the organs that are meant to make the patient survive have shut down and no longer working as they're supposed to. The commonly affected sites in postoperative synergistic gangrene or Meniere's ulcer or Meniere's gangrene include the thorax, the abdomen, the hands, and the legs. The individuals that are at risk of developing postoperative synergistic gangrene or Meniere's ulcer or Meniere's gangrene include patients that have undergone surgeries for some reason, for example, pelvic surgeries, abdominal surgeries, especially abdominal surgeries that are dirty or contaminated. For example, a patient had a perforation, that is, they got a hole in the intestines or the stomach. Or maybe the patient has pus in one of the organs. Patients that have sustained injuries to their body, for example, major injuries or minor injuries. For example, the patient got involved in a road traffic accident and sustained some injuries. And also patients that got minor injuries. For example, they were stung by a bee, for example, or they were hit by a bull or a cow, or they just got injuries, but minor injuries. Patients that are very old, patients with hypertension, diabetes mellitus, heart conditions, patients that are obese, malnourished patients, alcoholics, smokers. The clinical presentation of the postoperative synergistic gangrene or Meniere's ulcer or Meniere's gangrene is that the condition usually starts from the injury, the area of injury. For example, the patient had a surgery or got stung by a bee, for example, or got hit by a bull or a cow or any animal, or just sustained injuries from a road traffic accident. The problem, the condition usually starts from the margins of that wound or the area of injury. And it starts as pain. After that, the surrounding skin will become reddish. We shall have blister formation. The blisters will turn black, get eroded, and then we form an ulcer. But please also look out for the early warning signs before we even get the ulcer. Please look out for the fevers, look out for feeling cold, shivering. Please look out for sweating, dizziness, blurring of vision. Look out for an increase in heart rate. You feel like your heart is beating very fast and you feel like you're breathing very fast. And when the patient comes to the hospital, we usually take their blood pressures. They're usually very low blood pressures. Sometimes the patient can even have loss of consciousness and also a reduction in the amount of urine that is being produced by the patient. The investigations that we carry out in postoperative synergistic gangrene or Melanese ulcer or Melanese gangrene include a blood culture. So when you come to the hospital and you have that history of you got an accident, you had a surgery done, and by the way, this condition usually sets in 7 days after the injury, majority of the time. So when you have that history of what I've just told you, we usually do what we call a blood culture to make sure that we find out if your blood has any bacteria, especially multiple bacteria, because remember this condition is caused by multiple bacteria. So when we are able to isolate multiple bacteria, it can easily point to a possibility of this condition, the postoperative synergistic gangrene or Melanese ulcer or Melanese gangrene. We also do culture and sensitivity because majority of the time there is pus coming out of the ulcer. So we take off a sample of the pus and we find out what bacteria are residing in this ulcer. And this can help us to tailor our antibiotic therapy towards these bacteria that have been isolated, that have been grown in the culture. We also do liver function tests, renal function tests, just to make sure that these organs are okay. They have not yet been damaged. We also do a CT scan of the affected area, for example, the abdomen, the chest, just looking out for pus within the layers of the body, especially that space between the fat tissues and the fascia, the sheath that covers the muscles. Usually in this condition, there is pus in that space between the fascia and the fat cells, the fat tissue. We also do a complete blood count, making sure that at least we have a baseline of how much the cells of the immune system, for example, the white blood cells, how much they were elevated. And also how much, it also can tell us how much blood the patient has. So that if there is any derangements in maybe hemoglobin count, we can easily give the patient blood. We also do some investigations to monitor the progress of treatment. For example, we do what we call a CRP and ESR. These are just investigations that are going to help us see the progress of the infection, whether it is responding to treatment or it is just worsening. We also do serum electrolyte levels, looking out for any derangement in the electrolytes, for example, sodium, potassium, and chloride. And majority of the time, the patients have a reduction in the sodium levels. And this can help us correct these derangements so that the patients can easily recover from this condition. When it comes to the treatment of the postoperative synergistic gangrene or Melanese ulcer or Melanese gangrene, we usually give IV antibiotics tailored by the culture and sensitivity results or the blood culture results. And this can help us target the exact bacteria that are causing this condition in this patient. We also give IV fluids. We also give medications to make sure that the blood vessels are narrowed so that the blood pressures can easily be elevated. We can also do what we call debridement. Debridement is cutting away the dead tissues. Surgical debridement. We cut away all the dead tissues. And we continue doing ulcer dressing for some time. And when the ulcer has healed, we do what we call a skin grafting or skin flaps. We also do a procedure called abdominoplasty or commonly known as a tummy tuck. And this is more superior to the skin grafting and the skin flaps because patients tend to take a shorter duration of stay in the hospital when we do abdominoplasties or the tummy tucks than when we do the skin graftings and the skin flaps. When it comes to the prevention of the postoperative synergistic gangrene or Melanese ulcer or Melanese gangrene, I implore you to be skeptical, looking out for the warning signs. For example, look out for pain within your wound, especially 7 days after the injury or after the surgery. Please look out for fevers, look out for reddening of the area, look out for sweating, shivering, and any skin changes, for example, blackening of the skin, blistering of the skin, any changes in your heartbeat, breathing rate. Please look out for those things because those are warning signs of the postoperative synergistic gangrene or Melanese ulcer or gangrene. I also implore you to avoid being a candidate of the risk factors. For example, diabetes mellitus, hypertension, obesity, malnutrition, because remember that a patient in this category can easily die or get this condition, although even this condition can affect the healthy people, but the people that are within the categories of the risk factors that I've told you tend to be more susceptible to this condition. But this condition can also happen in the healthy people. I also implore you to be vigilant in working hand in hand with your surgeons, with your doctors, to always optimize you, just in case you have these conditions going on. For example, you have heart conditions, you have hypertension, you have diabetes mellitus. I always want you to work hand in hand so that you can be optimized before the surgery, because this can lower your chances of getting this condition. And of course, please avoid smoking, avoid alcohol. Yes, that is what I had for you. Thank you so much for listening to me. Please share my videos and also subscribe. See you in my next video. Bye.